Hello and welcome to HDtv Health District Television, brought to you by the Southern Nevada Health District. I'm Brian Gresh. One of our main focuses in this program is to provide perspective on health issues of interest to you. And so we're going to start with an update on the H1N1 virus, or swine flu, because we realize many of you have very real concerns, and the amount of information swirling in the national media is daunting. Of note, since our last broadcast, the FDA has approved the vaccine for H1N1, and as Health District Public Information Manager Jennifer Sizemore explains, the virus so far is not presenting any worse scenarios than originally predicted by the world's epidemiologists.
Thanks, Brian. In our most recent programs, we outlined how we and most public health agencies have been monitoring the H1N1 virus, what we call surveillance. We explained that during the summer, flu season would run its course in the Southern Hemisphere, and that would hopefully provide public health officials in the Northern Hemisphere with a preview of what the season might look like, with the addition of the H1N1 to the normal seasonal flu.
Well, the virus that we're seeing circulate now looks very similar to ones that we see circulate during our regular seasonal flu. Now we have a little more experience with it. We know it looks like what we're used to dealing with. It's nothing more serious or more severe. It really looks like the kind of flu that we deal with every single year.
Keep in mind, pandemic simply means a disease spreading globally. It doesn't refer to the severity of a disease. And every regular flu season, tragically, results in some deaths.
What we've seen in the Southern Hemisphere so far this year is that it looks like what we saw here in the spring. The people getting sick are particularly the youngest people. We're not seeing a lot of disease in older people, and the patterns look very similar to what we saw here in the United States. Well, from the death rates we've seen, they're very similar or lower than what we normally see during typical flu season. It doesn't appear to be much more severe or really any different than what we deal with in a regular season. It looks like a pretty typical flu virus compared to the ones we usually work with.
What's different about the H1N1 virus compared with seasonal flu is the age group it's mainly targeting. Where we would normally expect the more serious cases of flu in those over 65 years of age, H1N1 is for the most part bypassing that age group and striking children and young people under the age of 24. Researchers believe older people might have been exposed to a similar strain of the virus several decades ago that gives them a small degree of immunity to the current strain. It's for this reason that federal guidelines for upcoming H1N1 vaccinations look a little different from those of seasonal flu. When the vaccine becomes available, possibly in the later part of October, it will, out of necessity, be administered to those most at risk first. Those groups are pregnant women, caregivers of those who live with children less than 6 months old, healthcare workers and emergency response personnel, individuals between the ages of 6 months and 24 years old, people between the ages of 25 and 64 with chronic medical conditions, compromised immune systems, and who are at higher risk of complications from H1N1 infections. As additional shipments of vaccine are received, we anticipate we will be able to expand the number of people who will be eligible to receive immunizations.
Well, we're working very closely with all of our partners and our school district especially in order to try to provide accurate information as we learn more, and we can translate national recommendations and guidelines coming from the federal government and the Centers for Disease Control and Prevention. We're in close contact all the time with the State Health Division, the Chief Health Officer, with the medical providers in the community, and one of the definitive and effective places that parents can go is the website of the Southern Nevada Health District, because as we know that we're going to have rapidly changing recommendations and guidelines as we get them from CDC and they get them from the studies that are underway, and that's where we're going to be posting information so that we will be able to provide accurate written guidelines to everybody. So the first place to go would be the website of the Southern Nevada Health District.
And additional information about the H1N1 vaccine can also be found on the Centers for Disease Control and Prevention's website, cdc.gov. For those of you without internet access, the Health District has established a local H1N1 telephone hotline at 759-4636, or for people outside of the Las Vegas area at 1-866-767-5038.
As flu season progresses, rest assured the information and services available to you at the Health District will be timely, relevant, and accurate, however you access it, and we welcome your questions.
We're in this together, and by working together, by communicating constantly, and by rapidly trying to provide information as new recommendations come to us from CDC, we will know how to work together to get through this fall with this new outbreak. And we will do that. We will be successful together.